All right, guys, I'm going to go over blood sample collection with you. So I'm going to upload this hopefully to YouTube, and then you guys can watch it as you're going over this lecture material. Blood sample collection is huge, of course, for veterinary medicine. Just like human medicine, we need to get blood to figure out what's going on with our patients. So we teach you some of the basic ways to collect the blood. As an assistant, you also will need to know which blood tubes to use. So when we say, okay, we're going to run a CBC, we're going to run a chemistry, you'll need to know, okay, well, I need to grab this tube and this tube and this syringe and everything. And we kind of tell you and teach you, of course, which tubes to use. So we're going to start here. Like I was just telling you, of course, you guys are going to be the ones that are responsible for handling the samples, running them, so you learn how to use the lab machines, and then you may be collecting as well. Once you guys get to your externship, you do have the possibility of drawing blood, and they will kind of walk you through that. We walk you through it a little bit in Assist. Once you get to the tech program, you actually will be drawing blood from patients. The main thing here, of course, is knowing how to handle the samples, preparing them, running blood, knowing how to use the lab machines. And then, of course, big thing here is that any error, of course, any human error can alter the results, which then can alter, of course, treatment. And that's a huge problem if we don't know what we're doing, and then we do something wrong, and the doctor's like, oh, your pet has cancer, and the patient doesn't. It's just maybe just a mistake on our part. So venipuncture, of course, collection of blood. So we are going to go over the veins that we use for drawing blood. You guys have already used, well, we've gone over restraint techniques. So you guys already are a little bit familiar with some of these veins. So when the person needs to draw blood, you're going to need to know, okay, well, I need to restrain this way if we're going to do a cephalic venipuncture versus a saphenous venipuncture or jugular vein venipuncture. So needle and syringe are used. Like I said, you may be drawing the blood, you may be restraining to do the blood draw. You'll need to know how to restrain. You also need to know what supplies. So syringes, what size needle, which blood tubes we're going to use, all based on usually the panel that we're running or what the doctor is requesting. Here are our most common blood collection sites. Jugular vein we use, of course, that's the one that runs down both sides of the neck. You guys have already kind of learned how to do that restraint technique for that. Jugular vein, if we want a large amount of blood, we're going to use that vein. It's one of the bigger ones. We can get a large amount of blood out of that vein on either side. So we'll go for the jugular vein if we did need, let's say, like 5 milliliters of blood. Cephalic vein here, this is the one that we use for catheter placement, so intravenous catheter placement. We can draw blood from this site if we're going to do something simple like a heartworm test or, what's called a 4DX test for 4 different things, and it's like a 15-minute test. It only takes 3 drops of blood. So 3 drops of blood, and then we mix it with something called a conjugate, which is 4 drops, and you mix it, and then you use that with the test. So really, it's a quick blood draw, 3 drops of blood for that particular test. We're going to use that cephalic vein versus, we need 3 drops of blood from the jugular vein because we don't need that much. Lateral saphenous, if you guys remember, that's going to be for your dogs. We use that a lot of times if we don't want to mess with that front leg, if we're concerned about, we don't want to do what's called blowing the vein, which is you put a needle in or you try and put a catheter in, and then you've gone through the vein. Now there's blood pooling under the skin, and that's called a hematoma. They're a little bit painful too. It's almost like having a bruise. It's sensitive, and we don't want to do that to the patient. Especially if we are trying to place a catheter, we're going to avoid that front leg there. We're going to go for the back leg. Sometimes also patients that are arthritic in the front end, they do better with this lateral saphenous vein. Femoral vein, or like we talked about is medial saphenous vein, that's what we use on the cat. So that's that inner vein on their inner thigh area. Coccygeal vein is the tail vein. We'll do that a lot in large animal medicine. You can draw blood from cow that way. And then also in lab animal medicine, we will do rats. We can draw blood from their tail vein. All right, so jugular venipuncture we talked about. If we want a large amount of blood, we can do this in anything. Of course, the larger the animal, the bigger the vein. If you think about a horse, they have huge jugular veins. It's like a hose, so pretty easy to draw from. Of course, like we said, larger volume of blood. It is located next to the trachea, which of course is what helps. That's that entry into where the lungs are. So we have to be a little careful, make sure we're not like perforating the trachea. And it's not a hard thing. The more blood draws you do, especially in extern, the better you're going to get. So practice makes perfect, of course. It is easily accessible. Like I said, it does run down either side of the neck. So here you go. Here's a good picture for you. So person's restraining, kind of looks like he's holding like the lips here of the dog, but mainly holding the head, making sure that the person drawing the blood is not going to get bit. Needle goes in and she would be holding off one side or the other. So we wouldn't normally hold off both sides because unfortunately the patient could pass out because you're kind of cutting off the blood flow. So she looks like she's holding off here on the right side. So you put pressure on there, and that's how we get essentially pressure on the vein, and then she goes and she's getting blood that way. All right. Feline jugular venipuncture, that's kind of a wonky way to hold the head from what I told you guys. Mainly you're gonna do what works best. This might be a little, it might be okay, only because they're kind of covering the eyes here of the cat. And a lot of times cats do better when you cover their eyes. But we do have better restraint tools for that. We can use a cat muzzle. We have these cat muzzles. I'll have to show you guys. Actually, you're going to see it in your nursing class in 160. But it kind of looks like a, what's that movie? Silence of the Lambs, where they put that face mask over the scary dude, serial killer. Kind of looks like that, but it covers their face. They can still breathe because their nose is not covered up, and then it goes over their eyes. We prefer, I think it's a little safer, especially when you're first learning. You either do, like I was telling you, you put one thumb underneath the chin here, one on the head, or you put your hand behind the head away from the mouth and do that like baseball hold. And cephalic, both dogs and cats, going to be on the forelimb. I just talked about this, so we wouldn't want to use that cephalic vein if we were concerned about, we're going to use that vein for a catheter. So we would definitely avoid the cephalic vein unless maybe they're just in for a routine, blood draw. Let's say they just will not tolerate a jugular venipuncture restraint. Cephalic vein is a little less invasive. Like I showed you guys, you hold the head, you kind of extend that front leg and the person takes hold of it, and they can get blood that way. And that is kind of, it's not our go-to if we need to get even like 3 mils of blood, but we will use it sometimes if we're concerned, they won't tolerate the jugular venipuncture or, something like that. This is showing you guys kind of where you go. So here's the leg. I think I made the mistake on my last video, and I think I told you guys the elbow area. Mainly what I was trying to say is you go up almost in their armpit here. So you go back, you put your thumb down, and you turn slightly, like you twist. You do it away from the body, so away from yourself, and that's going to make the vein pop out. All right, so there's that one. Lateral saphenous, talked about only in dogs. We're going to do that vein on the outside. We don't do it on the inner thigh. That's for cats. Usually requires two people again. This one is a little bit harder. If you're on your own, let's say the person is holding the dog for you and you go to do it, if you're able to hold off that vein yourself and draw, that's awesome. When you're first learning, it's a little easier for you to have someone else occlude the vein. So they put a little bit of pressure around the knee, like I was telling you guys, and then you can put your hand on the leg and mobilize that vein, because this particular vein is very, what they call rolly. It's just very wiggly. It likes to move around. So as soon as you try and put your needle in it, it like moves to one side or the other. So a little harder, a little easier if you have someone occluding it for you while you draw. Got our awesome hairstyle here from, I think, like the 70s, 80s. Can't say anything because I was born in the 80s. But here's her restraint. So again, she's got her arm on the neck there, just a little bit of pressure, make sure he doesn't get up. She is holding a little bit of pressure on the vein there, and then making sure he's not able to get up. All right, medial saphenous venipuncture for cats only, or the femoral vein. inside that hind leg, and then usually it's going to be a small amount of blood. That particular vein is very small in cats. It's kind of hard to see. You have to put alcohol on the leg to kind of flatten down the fur, and then you kind of move it to one side or the other to even make the vein visible. So of course you can't see it here, but we're doing that stretch. We've got the forearm, making it so they can't back up. They're scruffing, but not too hard because, of course, like I said, you don't want to see their eyeballs go back. And then bringing the hand down gently to put some pressure on that vein, and then this person's drawing the blood. Here's some extra things, just extra information for you guys. So here's the restraint that we would use. So standing, sitting, lateral. And then this is going to tell you the volume that you can collect from those areas. So we can do 20 mils of blood from the jugular vein. Hematoma, I mentioned, is collection of the blood under the vein, essentially, like where you tried to draw blood from that vein. Let's say you either went through the vein or you kind of poked around trying to find the vein and you broke it open, essentially. It causes that hematoma. And then animals we can do it in, of course. Livestock, exotics, like I said, the horse jugular vein is huge. And then cephalic risk, again, used for intravenous catheter. So we try and avoid it if they're there for something that would require a catheter, like surgery or they were sick. Lateral saphenous and medial saphenous up to 2 mils. And then coccidial vein kind of depends on the animal. Again, we're not going to be drawing a bunch of blood from like the rat tail versus like a cow because cow, of course, they have more blood because they're huge. I mentioned holding off. And really what that means is you are just restricting blood flow. So then it makes the vein pop out more. It's easier for you to see or the person drawing to see. And then it's dilating the vein. It also is making it so, you're putting pressure on that vein, it's going to pour into that syringe then when you're drawing back to get the blood. So when you're restraining an animal, the person's going to say, okay, go ahead and hold off for me. That means go ahead and put some pressure on that vein for me so I can see it. And then some tips for venipuncture. We're going to talk about this. When you are holding the needle, or the syringe, syringe has a needle on the tip of it. Of course, the needle is what's going to go into the patient, through the patient's skin into the vein. It has something called a bevel on it. And it's the top side of that needle. It's got this opening. And then this right here is the sharpest part of the needle. You always want to make sure that the bevel is up. So then when you're going into the patient, that sharpest part is going to go through. And then immediately the blood will pour into this area. If you turn this upside down and try to go in, you'd probably still go in, but the angle wouldn't be as good, that the sharpness, and then even just trying to get blood is going to be a little bit harder because now we're kind of pushed down. There might be some occlusion there where you can't get the blood in through the needle. So you wet down the hair with alcohol, just isopropyl alcohol, or any other antiseptic solution. It's not necessarily to like sterilize that area. It's just to wet down the fur, clean it a little bit. And then what you'll do is, if you're the one drawing, you can hold the paw, if that is where you're drawing from, like the cephalic vein, and it's called pumping, kind of like how when you're getting your blood drawn, like by a phlebotomist, they'll have you hold on to one of those squishy balls and you hold it and you kind of squeeze it a couple of times. It's going to essentially put pressure, dilate the vein a little bit more. So if we need to, let's say they don't have great blood pressure, they've got some blood pressure problems, they're dehydrated, we can pump the paw a little bit. You're just holding their paw on, you just kind of squeeze it gently, and that helps with the blood pressure sometimes. Again, always insert with bevel up, like I mentioned. And then more tips for you, especially with the saphenous vein. If you put your thumb next to that vein, it's going to stabilize a little bit more. So like I was telling you, you go to put your needle into that saphenous vein and it's super wiggly. It likes to roll around. You put your thumb next to it, kind of stabilizes a little bit more. So when you go to put the needle in, it's going to bump up against your thumb versus just kind of wiggling around. 10 to 15 degree angle, usually we're going in. You'll get what's called a flash of blood. If you are in the right place, as soon as you put your needle in and you draw back slightly on your syringe, you're going to get a flash, which is just blood is going into that needle hub and then into the syringe. So a flash is good. That's what we want to see. And then again, if you go too far, you can actually go through the vein. That's where we start seeing hematomas. If, let's say, we had a super tiny needle, 25 gauge, I know that sounds huge, but in veterinary medicine, well, I'd say in human medicine as well. If you think about going and getting like a piercing done, they'll say, okay, we're going to do like a belly button piercing. And they do use like a 16 gauge needle. The bigger the number, the smaller the needle. So a 16 gauge is bigger than a 25 gauge. Let's say I took a 25 gauge needle and a 10 mil syringe, like a really big syringe, and I went to draw blood from a jugular vein on a chihuahua. If I try to do that, the needle is too small, the syringe is too big, I'm going to collapse that vein, which means that I'll go to draw and it's just going to suck so hard on the vein, it just collapses and you're not going to be able to get anything out of the vein. So essentially, you got to do needle that's appropriate, syringe that's appropriate for your patient, and you learn all that in your nursing class as well. The other thing is, let's say we go in, we're not getting a flash. We can reposition if we need to. So that means you gently take the needle out a little bit, not completely out of the skin. You pull back slightly and you redirect it to the left, the right, whatever is needed to try and reposition it. Maybe you're like right next to the vein, you can't get it. So you pull back slightly, you go back in a different angle. And that may make it so, well, let's say you were just next to the vein, now you're in the vein just because you repositioned. And then once you're done, you as the restrainer or the person drawing the blood, if you're doing that, you're going to tell the person to apply some pressure, or they'll tell you, okay, I'm done drawing the blood. You'll put your fingers, your hand over the area where they were drawing the blood so they're not bleeding from that area. That's how we prevent hematomas. You usually put your fingers, your hand over that area for about 10 to 30 seconds, enough for the area to kind of clot, close up, you're good. You also don't want to put too much pressure because that will restrict the platelets from clotting at that site. So main thing would be 10 to 30 seconds, apply pressure, and then you're done. So as a restrainer, you always apply pressure when they're done. A lot of times the person drawing the blood may put their fingers over the site, pull the needle out, and then wait for you to then put your hand where theirs is, just to make sure the patient isn't bleeding. We're going to use hydrogen peroxide. Fun tech tip. For whatever reason, white dogs tend to bleed more. I think it's because they have those really pretty white coats. And of course, they bleed, it stains the fur. You go to use hydrogen peroxide, and it seems like then the white fur turns brown. But not terrible. We can fix that. So we just use hydrogen peroxide to clean the fur. And then if we need to, we can do a pressure bandage. If we're concerned, hey, they're still bleeding even though I've applied pressure, we'll take a piece of gauze or a cotton ball and some vet wrap. That's what this is. And we'll wrap it around that area and keep it on there for about 30 seconds. And then we can tell the owner, let's say 15 minutes from now, you can take this off, or we can take it off. Just depends on what's going on with the patient. Here's your equipment. You guys can kind of look over that. Your needles, syringes, butterfly catheter is just a smaller needle, and it's got like a little tube connected to it, or like almost like a hose connects to it. You can put that into your blood tubes, or depending on what you're drawing from, we can do a butterfly catheter in a cat or a kitten because they're so tiny. Syringes, we can go all the way up to 60 mil, which is huge. We wouldn't normally use that in small animal medicine for blood draws. Vac containers, they use a lot more in human medicine. We can use it in vet medicine. They have it where you have that little contraption that you put the blood tube in, and you keep your needle in the vein, and then you can just keep changing out your tubes like they do in human medicine. But you have to be really good at your venipuncture drawing. Otherwise, the vac container doesn't work as well. And then here is your needles, all different types. The colors are not, don't get too caught up on the colors, because unfortunately we found out, depending on the manufacturer, the colors can change. So like pink says 20 gauge where I work, hospital I work at, 18 gauge is pink. I've worked at hospitals where 18 gauge is green, but now where I work it's pink. So don't get too caught up on that. And there are collection tubes. So there's different tubes that we use depending on the test that the doctor is ordering. And you'll need to know if the doctor's like, all right, I need to do a CBC and I need a chemistry, like I was saying. you'll need to know, okay, I need a purple tube, I need a serum separator tube. Those are the two I'm going to use. It all depends on the test you're running, what the doctor wants. It all varies based on what the tube does. There are tubes that will separate serum. There's ones that separate plasma. There are ones that will help the blood clot, help the blood not clot. All kind of depends on what it is we need. And then here's your components of blood. We're going to talk about that more tomorrow. So whole blood, plasma, serum. This is going to be pretty much everything that makes up the blood. And then the plasma is the fluid portion of the blood, separated from the cells, doesn't coagulate or doesn't help with coagulation. The fluid portion of the blood that separates the cells, but it does not have clotting factors, is your serum. And clotting factors are important if we've got a patient that's having let's say they don't have any platelets, they're not clotting. That's a concern when they're going into surgery, and maybe the doctor's going to have to cut into the patient. If they can't clot, they could bleed out during surgery. So that's why that's so important. Serum we're going to get by letting the blood clot. We'll go over serum separators in just a second here. So we take this sample, we draw blood, put it in a serum separator, we spin it down in the centrifuge. Once it's done spinning, you're going to have blood at the bottom of the tube, the little separator in the middle, and then your serum at the top. And there'll be pictures as well, like I said. So this is showing you whole blood. Again, not coagulated, plasma, not coagulated, serum, plasma without those clotting factors. So this is trying to show you like a hematocrit tube. What that does is it's a tiny tube. Once you spin it down, you've got your red blood cells at the bottom, white blood cells and platelets in the middle here, and plasma at the top. All right, clotting tubes. Anytime we put blood in a tube where we want the blood to clot, we have to let it clot prior to centrifuging. So what happens is we usually let it sit for about 5 minutes, allow that blood time to clot in that tube, and then we'll centrifuge it down. If we let it sit for too long, unfortunately, glucose will be used up by the cells, and that will actually affect our results. So I mentioned tiger top tube. It's called tiger top just because of the way it looks. There's black and red on here. It's supposed to be like a tiger. We'll see it abbreviated on like lab forms as SST, which just means serum separator tube. It's got a gel serum separator. That's what this piece right here is. It's just a gel. So when you spin it down, that'll move up and it'll get the whole blood at the bottom and then that serum at the top. All right. So this one does clot, like it says, usually you centrifuge 5 to 10 minutes, and then we'll do chemistry tests on that particular tube. Red top tube, these are kind of named for, of course, the way they look as well. So red top tube. This one shouldn't have anything in it. Oh, sorry. Let's go back down here. So RTT, red top tube. Plain tube has no additives. We'll use this a lot for urine, or if we're going to do maybe drug levels. Phenobarbital is used for seizures. It's like a maintenance drug that they would need to be on daily if they were suffering from seizures. If it had some kind of clot activator, we would need to let it sit, let it clot, and then we'd centrifuge. Most of the time, though, at least what I want you guys to remember for now is that red top tubes are used for urine. There's nothing in them. We put urine in there and we use that to send out to the lab. Okay. Then anti-clotting tubes. So blood's not going to clot in these. They have some kind of anticoagulant in them. So the lavender top tube is the one used most. There's also green and blue. Lavender, I'd say we use the most in practice. When we need a whole blood test, we want to run like a CBC. We'll take a purple top tube. It's got EDTA in it, which is ethylene diameta. Can usually say this word. Ethylene diamine tetraacetic acid. So that's going to bind to calcium, and that's going to make it so the blood doesn't clot. So it stays in that tube. What we do is as soon as we get the blood in that tube, not converting, but we take it and we'll kind of mix it. We don't shake it up. We just move it back and forth in the tube to make sure that all the blood is touching all of that EDTA. So CBC, complete blood count, total protein, platelet counts, and then SNAP test I mentioned, 40X, that's a SNAP test. The reason it's called a SNAP test is just the way that it snaps down. We have to actually push it down to close it and snap it in place. Green top tube, plasma is going to yield plasma. This has lithium heparin in it. And then the thing is, unfortunately, the chemistry test, the heparin can mess with those results. So if we want to do CBC, we're going to use our purple top tube with EDTA. Again, that's going to yield plasma for you. We'll do that for electrolyte testing. Just if we're concerned about, dehydrated, we want to see what their electrolytes are, we'll use a green top. Blue top tube has sodium citrate in it. Coagulation tests, again, if we're worried about them clotting, if we want to do clotting time, or if we need to do maybe a blood transfusion, we can use a blue top tube. That's what cross-matching is. We're going to cross-match, see if their blood matches another patient so we can do a blood transfusion. Here's some review for you. Tiger top tube. So no anticoagulant. It's going to clot. It's got a clot activator, usually gel in it. And that's for our chemistry tests. Red top tube, no anticoagulant, plus or minus. There's a clot activator. It just depends. Mainly, like I said, remember that the red top tube has nothing in it. We use it for urine. You guys can look over this. And I'm going to go over something later, actually, with you guys for your homework. This kind of breaks everything down for you, and it even has some photos for you of each tube. One of the things we do have to remember, most of these tubes are fine to sit on the shelf for a little bit. We're going to go through them. It's not going to get to the point where they're going to expire, except for the blue top tubes. Those, unfortunately, are only good for a couple of months, and a lot of practices don't use them if they're not doing either cross-matching or clotting times. Where I work, we have blue top tubes, but we don't use them frequently enough that we would order a lot of them. So we usually only have like 1 or 2 on hand, because otherwise they're going to expire. And it's almost kind of a waste of money. If you work in emergency medicine, you're going to use a lot of those. So they have a lot of those on hand because they got to cross match, see what the clotting factors are, especially if it's emergency surgery. Filling blood tubes, of course, there is negative pressure on those or like a vacuum. So when you put your needle into that little piece at the top of the tube, it'll suck the blood from the syringe. You don't have to put any pressure on that syringe to push it into the tube. It's going to suck it right in. And it's supposed to know how much of the sample it needs. It should stop after it's got enough in there. Then hemolysis. Super important. You guys need to know this term. Means destruction of red blood cells. This is, let's say you put your needle into your tube and you push down. Well, now you've pushed all those red blood cells through that tiny needle and you're breaking them. You're essentially like it says, you're lysing them. So hemolysis is you're breaking down all those red blood cells. So here's a good picture for you to kind of show you what's going on here. So here's your red blood cell. Here's lysing. So that means now we put holes in that red blood cell. Let's say we push down so hard on that syringe trying to get it in the tube. Now it's just broken apart. What's going to happen then is when you spin down your serum separator, you're going to get what looks like a red serum, as opposed to serum is supposed to be a straw color. When you've lysed the cells like that, it turns the serum red, and that can actually alter your test results. The other thing we can do, instead of putting your needle inside the tube like that, so you poke it through that little top piece, it's almost like a lid, poke it through there. Instead of doing that, you just take the piece itself off, you take the needle off your syringe, and you fill it up that way. You have to be careful though, because a lot of them, these tubes need that vacuum in order for the lab machine to even work. So you just have to be careful which ones you do this with. There is kind of a specific order. Let's say we've got a serum separator and a purple top. So we've got one with a coagulant, one with an anticoagulant. We're going to do clotting tubes first and then our anticoagulant. The reason for that is because if we tried to fill our anticoagulant tube first, now we might have that EDTA or lithium heparin on our needle, and then we go to put it in our serum separator tube, and now we've actually introduced an anticoagulant into the serum separator. We don't want that. So it says like contains spillover. We want to make sure we don't do that, because again, that's going to affect our results. Usually you do whatever's required. On the side of the tube, it should tell you, can hold 2 mils of blood. So you're only going to put 2 mils of blood. If we put too little in the tube, especially an EDTA tube like the purple top, you can actually mess up again your results because you're going to have either too much coagulant and not enough blood, or too much blood and not enough coagulant. So now that is going to render your results, possibly false. It could give us wrong readings on our PCV, which is our packed cell volume, which we're going to go over more later. So we just have to be careful. We have to be mindful of that. And then sample holding. Main thing about this is remember you have to refrigerate it. So as soon as you draw blood, we don't want it to sit out again because of course then it's eating all that glucose. So as soon as we can, we're going to take the sample, and either if it needs to be centrifuged, we'll wait, centrifuge, and then immediately in the fridge. Otherwise, again, it's going to start affecting our results. Blood's usually only good for about 24 hours in the fridge. Again, the color of the serum, like I was telling you, it can change if we've lysed those blood cells. It could be a pink color. We normally want to see what looks like straw. Now, the color can change based on if either it wasn't handled properly. If let's say we were fishing around for that vein too many times with our needle, we kept like coming out and redirecting. You did it so many times, you actually started lysing the cells, the blood cells. That's another way. If they have liver disease, that's going to change and it's going to turn that serum a yellow color because of the bilirubin. And then hemolytic anemia, if they have something going on, that's definitely going to change the way it looks. And then our venipuncture, of course, the way that we do it can, again, affect the way it looks. So normal serum, again, needs to look like straw. If it's hemolytic, that means we've lysed the red blood cells, and it does. It kind of looks like Kool-Aid. If it's lipemic, usually that means the patient just ate. So if we draw blood, most of these panels are supposed to be fasted panels like in human medicine. Of course, with animals, that doesn't always happen. So we can still draw the blood. It just may be lipemic, which just means that there's lipids in it. There's fat from the food they just ate. And then icteric, bilirubin buildup. You can definitely tell when it's not the right color. So here's normal serum, at least what it's supposed to look like. So we've got, that's a serum separator top or tiger top tube. Here's the red blood cells. Here's your clot, I'm sorry, your gel. And then here's your serum at the top. That's what it's supposed to look like. Hemolytic serum. So here it's trying to show you normal, and then the red is, again, where we've lysed those red blood cells. Lipemic, that's the fat. Here's the other thing. So here's, let's say, a serum separator. We drew the blood. We've got the red blood cells here. We've got fat at the top here in the serum. If it's pink, that means it's also hemolytic. So we've got lipemia and hemolysis, and it legitimately looks like strawberry milk, which is kind of gross to think about, but didn't see what it looks like. And then icteric serum, kind of scary to see, but yes, that means there's something going on with their liver. Here's, almost looks like a hemolytic serum. And then here's this kind of pretty bright yellow, which means that there's something going on with the liver. It's not functioning properly. It's not filtering properly. And now the bilirubin is building up, and we can see it in the, not only in the blood, the serum, we can see it in the skin too. The whites of their eyes will turn yellow. The gums will as well. That's it for that. I'm going to go over a worksheet for you guys that you can do that will actually help a lot with these blood tubes. So watch this, kind of, pause as you need to take notes and stuff. And then what I'll do is I'm hoping to do a Zoom call with you guys, and we'll do that worksheet, and I can show you how to do it, okay? All right. I will see you guys later.